My name's Bruce Moore. I've been a firefighter now for 25 years. In order to be a fireman, it's a requirement to actually be in good aerobic shape, because you can be working long periods of time in very hot environments. I'm an older father of 2 young kids, and I wanted to be able to have a nice long career and be able to do things with them. So I worked out at least 6 days a week when the bell goes off and we need to be in shape for those particular calls. The day of the incident was just like every other day when I'm coming off shift. I went to the gym and did my normal workout, and it was right at the very end of my weightlifting routine that I kind of started feeling a little nauseous. So I just said, forget it, I'm not going to finish, and decided to go home. When I was walking out to the car, the nausea feeling started getting a lot worse, almost to the point where I thought I was going to vomit. So I went to my car, sat down, and just rested for about 2 minutes. And within those 2 minutes, the nausea went away. A couple minutes later, as I was driving home, I started feeling some pain in my right side of my chest. Well, while I was waiting at the light, I looked in my rearview mirror and I saw that I was ashen gray, profusely sweating. And usually when I see somebody like that at work, I know that it's a grave issue. And when I drove home, it just so happened that my wife was still there and the garage door was open. So I drove inside and yelled at my wife to call 911. But something inside her told her to follow me into the house. And as she did, I took about 10 steps in the house and I collapsed, landing face first in the house. You hear about it and you read about it all the time, something that happens like that, but never ever did I think that that was going to happen to me. And that's when Captain Ty Davis from CAL FIRE told his guys that just transport me to Loma Linda and take me to a STEMI center. And it was that call that helped save my life, because had they not taken me there and I gone someplace else, who knows if I'd be here even talking. Because they made a STEMI alert to the hospital that the cardiologist, Dr. Zaman, was there. And it was at that point that she looked at it and said, no, we're not going to a room, we're going directly to the cath lab, because she knew that I needed intervention.
When I hear the code STEMI, cath lab team, we're up there trying to raise and save the patient's heart muscle. When we get to the emergency room, we try to get the patient as comfortable as possible, talking to the patient, but also the family.
Well, he had a left anterior descending artery, which feeds the front part of his heart, and the bottom goes down the bottom front of his heart. And the branches that come off the side of it, all of those branches were also blocked. So it was a very large blockage that compromised, a good portion of his muscle of his heart. Heart muscle does not grow back. You can get some of your function back with medications, but that is why it's so important to get to the hospital, especially a hospital that has the ability to open up the blocked vessels in the cath lab as quickly as possible, so that you don't lose more muscle, because time is muscle, and the more time you wait, the more damage you're going to have to your muscle.
Well, my goal right now, and has been for the last 7.5 months, is to get back in shape to the point where I can actually go back to work. I miss the camaraderie, I miss the guys on the floor, I miss the calls, the excitement of all the calls. Give my wife a little break for me being at home so much. Kind of educate guys on the risks of cardiovascular disease and heart attacks. It's not just the diet and exercise. They got to look at their hereditary or the genetics, and hopefully this can raise a few eyebrows and get guys to start reconsidering some of the choices they're making in life.